Hi, my name is Dr. Doug Olson, and I would like to talk to you about carpal tunnel syndrome and carpal tunnel release surgery. I made this video to answer basically some frequently asked questions that patients have in the office, and it's something that you can reference back to after we have a discussion in the office. And so a lot of times patients will forget what we talked about. And this is a way to have access to that discussion that we had in the office again at home, as well as to share with family members so that they know what you may be about to be going through. But carpal tunnel syndrome is simply a compression of a nerve right here in your palm or hand. That nerve starts all the way in your neck, travels down to your carpal tunnel in your wrist right here, and the nerve is getting pinched. Symptoms of carpal tunnel syndrome typically are numbness in the hand, particularly on the thumb side of the hand, but it really can be experienced in the whole hand. Cramping of the fingers, pain, difficulty doing repetitive movements like handwriting, and a lot of patients experience a lot of nighttime symptoms. So they get woken up at night with a lot of pain, numbness, tingling in their fingers. And simple treatments initially for carpal tunnel syndrome that you can do on your own is wearing a brace on your wrist, particularly at night. The idea is when we sleep, a lot of times we sleep like this and we kink this nerve, and the brace helps keep your wrist straight and can help rest that nerve. Anti-inflammatory medications can help. In the office, sometimes, but kind of rarely, we will do a cortisone injection to the carpal tunnel to help with some acute symptoms. But oftentimes, even patients who have a cortisone injection end up having to have a carpal tunnel release surgery performed within a year. So it's just a lot of times delaying the inevitable. But what a carpal tunnel release surgery is simply decompressing or unpinching that nerve. So I make a small incision here on the wrist and get down to that nerve. There is a tight band of tissue called the transverse carpal ligament, and I release that transverse carpal ligament tissue. That unpinches the nerve, and that surgery can be performed sometimes under local anesthetic, where we don't start an IV, we don't sedate you, you can eat and drink that morning, you're fully awake during the procedure. The procedure takes on average 10 minutes or so, or for some patients, they're more comfortable receiving some sedation and kind of drifting off into a light sleep when we do the surgery. Oftentimes, patients pretty quickly notice some improvement in their symptoms. The first symptom that typically improves is any nighttime numbness or pain. A lot of times that improves within a day or two from surgery. The next thing to improve is pain, any daytime pain and tingling in the fingers. And lastly, if you had any actual numbness in your fingers where you couldn't feel what you were touching prior to surgery, that is usually the last symptom that improves. And for some people that's days, some people that's weeks, for some patients that's even months later it continues to improve. And there are some times where there has been permanent nerve damage prior to the surgery, and in those patients sometimes they don't get complete relief of all of their symptoms. And for them, the surgery is to help relieve the symptoms as best as possible, and then also to prevent progression of those symptoms. After surgery, patients leave the operating room with an ACE wrap bandage over their hand. I tell patients that they can shower 2 days after surgery. The vast majority of the time, I'm able to close the incision with all of the sutures underneath the skin and the skin glued shut. So in that case, we don't have to take any sutures out in the office. And there are times where somebody has a skin that is just more appropriate to have stitches over top of the skin. But 2 days after surgery, I tell patients that they can take off the entire bandage, shower, and then just replace the bandage with a Band-Aid, and they can recover the hand with an ACE wrap if they want to. But immediately after surgery, I encourage patients to start moving the fingers, even using that hand for light activities of daily living, like brushing your teeth or feeding yourself. I do ask that patients avoid any heavy grip, like getting a gallon of milk out of the fridge, or repetitive grip for 4 to 6 weeks after surgery. Prior to surgery, in terms of diagnosing carpal tunnel syndrome, sometimes it is diagnosed simply off of your symptoms and the physical exam that I performed in the office. A lot of times it is diagnosed, as well as history and physical exam, as by getting what's called an EMG test, or electromyogram and nerve conduction study. That's where I send you to another doctor who specializes in performing that test, where they put tiny little acupuncture needles in different muscles of the arm and hand, and can help identify nerve problems such as carpal tunnel syndrome. Carpal tunnel syndrome also more recently is being diagnosed using an ultrasound machine, sometimes in my office while you're there for your examination. Let's talk about some of the risks associated with undergoing a carpal tunnel surgery. With any surgery, there is a risk of getting an infection at the surgical site. Fortunately for carpal tunnel surgery, that is incredibly rare, less than 1% chance. There is a chance that I could injure something in surgery. So specifically for carpal tunnel surgery, I'm working around your median nerve, and there is a chance that I could injure that nerve. Although this is a surgery that I've done hundreds of times and do quite frequently. And again, fortunately, that is incredibly rare. And like I mentioned earlier, there's a chance of incomplete relief of symptoms. So sometimes if the nerve has been pinched too long prior to the surgery, we don't get 100% relief of the symptoms after the surgery. Thank you for watching, and I hope you found this video very helpful.